Good evening, everyone. Thank you for attending Health Hospitals and Social Services meeting on Tuesday, September 1st, 2020. It is promptly 5:53 p.m. And so I want to do a very quick roll. Councilmember Hurt is present. Councilmember Benedict present. Yes. Councilmember Glover. Councilmember Hall.
Present.
Councilmember Porterfield.
Present. I don't know if you heard me.
Thank you. Councilmember Pulley. Councilmember Welsh.
Present.
Councilmember Hauser.
Present.
All right, Councilmember Taylor's present. Okay, thank you. So as we start, I'd like to read the motion. Pursuant to Governor Lee's executive order number 16 regarding electronic meetings as extended by executive orders number 34 and 51, I make a motion that this committee meeting agenda constitutes essential business of the Metropolitan Council, and that the meeting electronically is necessary to protect the health, safety, and welfare of Tennesseans in light of COVID-19 outbreak. Do you have a second?
Second.
All in favor?
Aye.
Aye.
Any opposed? Good deal. All right, so our first resolution is RS 2020-496 by Councilmember Hall. Request the Director of Finance to take the appropriate action to recoup all funds appropriated in the fiscal year 2020-2021 Metro Government Operating Budget to the Metro Hospital Authority that were also covered by Federal CARES Act and other COVID-19 related funding sources. And Councilmember Hall, we see that you have a substitute on this bill.
Me? Okay, I think I muted now. Yes. So I do have a substitute. Been working with the administration to get these substitutes together from all the conversations from the previous council meeting, committee meeting. We had a great meeting and got, I think, a lot of clarity out of the situation. So I want to move the substitute, and that substitute, if I don't know if I've got Mr. Jameson on or someone from finance that could speak specifically to their substitute, but I don't see anyone on. Basically what this does, well, actually, Attorney Cooper, I believe he's on the call.
Councilman, Councilman Taylor, if you can hear me, I don't know if you can hear this.
Yes, Mr. James.
Thank you. We did have very productive discussions with the sponsor, and essentially what the substitute does is originally drafted, it would have required or asked the Director of Finance to go ahead and recoup monies allocated in the previous operating budget to the hospital authority that were redundant to funds allocated in the CARES Act subsidy. The substitute is drafted, which the administration could support, would allow the finance director to first assess the extent to which that actually occurred. We're not absolutely certain that there was redundancy, and then submit a report to the council for their determination based on the finance director's review. The hospital authority is undergoing an annual external audit of its financial statements. This is routine. That will be done by October 31st. So the finance director requested until December 31st, 60 days afterwards, to make the recommendation to council. And with that, the substitute would enjoy administrative support. Thank you.
So, Chair, for clarity, again, this is something that we've already discussed, but in the event, this is not saying, as you heard Mr. Jameson say, if there is a redundancy, this gives the external audit that's taking place to run its course, for the finance director and others to be able to go through and make sure that all that's listed. And so they won't have that report ready, as Mr. Jameson said, until the end of October, beginning of November. So we've got plenty of time. I just want to go ahead and get the substitute on, and then we'll revisit this in November when those reports are complete.
Mr. Chair,
Yes.
this is Steve Glover. I've been here the entire meeting, but we had an issue. So I don't know if you got a second on that or not, but if you did not, I will second that, please.
Perfect. We do have a second now. So Councilmember Hall has moved and Councilmember Glover has properly second. Do we have any discussion? And this is for the substitute for RS 2024-96.
Mr. Chair,
Yes.
this Councilwoman Hurd, is this same practice that we are reviewing all of the different departments or entities that receive COVID money to make sure that there's no redundancy across the board on any and all departments or entities that receive the same funding?
Councilmember Hurt, thank you for that question. I don't believe so. Mr. Cooper, would you be able to have any detail if any other departments are asking to have their funds recouped, that if they received funds from the federal government?
So, council member, for all other Metro departments, those funds come into Metro and then the council appropriates the funds to the departments. Since the hospital authority is a standalone entity, the funds went straight to them from the federal government. So I'm not aware of any other similar situations in Metro.
Thank you. Councilmember Hurt, does that answer your question?
Yes, thank you.
Thank you. Do we have any other discussion? All right. Seeing none, again, this has been moved and properly second. All in favor, please vote with your hand on the, please vote with your hand on the WebEx.
Chairperson, I don't have the WebEx right now. This is
Okay.
Glover, and I'm voting in favor of.
Okay. Perfect. So, this is voting for the substitute. In favor, we have Councilmember Taylor, Councilmember Benedict, Councilmember Welsh, Councilmember Hauser, Councilmember Hall, and Councilmember Hurt. All right. Please keep your hands up for 1 second, and I have you, Councilmember Glover.
I have another question.
Councilmember Hurt, we are voting in the on the bill or on the substitute.
Right. Right. I just need some clarification. So if we are voting for the substitute and they find that there is some redundancy, does that mean that this will come back? Or, what actually does that mean? Or does it automatically mean that the funds will be recouped?
Councilmember, this is John Cooper. The way the resolution is written, a report would come back to the council, and if the finance director determined after that review that there was some redundancy, then the council would have to, I believe, take action as to what to do with those, or whether to take additional action.
So if it's if it's redundancy, but if the money can be accounted for and it was actually used for the things that they needed, you know, I guess I'm having a difficult time trying to figure out what would be the concern, because
Point of order, Chair. I thought we're on the vote now, right? I'm sorry, with all due respect to Councilwoman Hurt, I believe that we're in the middle of the vote.
well, I'm trying to get clarification about the vote, about what it is that I'm voting for in terms of the substitute. What would be the consequences or of the vote?
So currently, right now, we're voting to add the substitute, and then can open it up if the councilman would like to move for approval on the substitute, then we can have more discussion around what the substitute would do.
At the risk of sounding rude, point of order was called. Mr. Cooper, where are we on the vote, please?
You're voting on adding the substitute to the resolution. It will then go back for a motion to approve as substitute.
Okay. And so while we're voting right now, are we voting? Are we still in discussion?
We're still in the vote.
I'm sorry, I couldn't hear you.
We're still in the vote, Councilman Glover.
All right, thank you. Then we should vote. Thank you.
Right. All right, thank you. So please, everyone, remove your hands. And so now all in favor, I'll have 6. Anyone against?
Excuse me, Chair. I'm voting in favor of the substitute, Councilwoman Porterfield.
Thank you. Anyone against?
I am.
Okay, thank you, Councilman Hurt. All right, perfect. We have any abstentions? I believe so. So we have 7 in favor, 1 against for the substitute. Substitute pass. Councilmember Hall.
I'd like to move for approval as substituted with a brief explanation for further clarity.
Second.
Been probably moved in second. Councilmember Hall.
In directly to Councilwoman Hurt's point or question, in the event of any redundancy, then that would mean that it's not taking the CARES Act funds away. It's not taking the money that we allotted in the budget away. Both. It would be one or the other. It's simply saying redundancy, meaning using money twice for the same one thing. And so if there's money that has been a redundant payment, it's not going to take that payment away or take away that item that they're spending that money on. It's simply going to say that one of those things will pay for whatever it is, and the other money will come back to us to determine what to do with it. There's a very short and very specific list of what the money can be used for. That came with that CARES Act funds. The finance director has it. If it has not been disseminated throughout the council, I would ask that we could get a copy of that to Attorney Cooper and then that to all the council members. But it's just simply saying in the event of redundancy, whatever's to be paid for would still be paid for, but not twice, just once, and that other money would come back for us to determine what to do with. It may be funds there, it may not be funds there at all. So it's only in the event of, and that's what the external audit is for. In addition to that, yes, it is only that I know of this situation because everyone else's money comes through council and then is allocated, whereas hospital is different because it goes directly to that authority, hence triggering the external audit. With that, I'd like to move for approval as substituted.
Second.
All right. Councilmember Hurt.
So that means that if the money is being utilized to help stock their food pharmacy that was received from CARES Act, and there's also money that has been allocated in the subsidy that Nashville General gets for their food pharmacy, that means that that money would have to be recouped, and they could not add more food to the pharmacy to serve its constituents or its patients?
No. The food pharmacy is funded through a separate funding source, and it would only mean that either the money allocated in the budget that would go towards that, the private dollars that they got toward that, they would all keep. The CARES Act money would go back, or vice versa, meaning the CARES Act would stay and what we allocated would come back, but just not two things for once. And if you look at that list of items that can be paid for with that CARES Act money, the food pharmacy is not within the money that CARES Act money can be used for.
So I guess the question is that I just used the food pharmacy as an example. My question, I guess, the point that I'm trying to get to is that if it is needed, so for instance, they got $100,000 from the CARES Act for one thing, but they also needed a total of $300,000 in order to address this one issue. The subsidy that they received from Metro gives them $200,000, and then the CARES Act gives $100,000. So that total that they needed is there. But if you're saying that there's some redundancy, then we lose one of those $100,000, correct?
No, ma'am. You would only lose that if the money specifically could be utilized for that. They may have 5 things that they know they can use the money for. But if those 5 things aren't on the list of items covered by the CARES Act money, then it's not a redundancy. It would be what we allocated in the budget would pay for that, and the CARES Act money that's left over would come back. You're not losing that money, but if those items, if they need to utilize money for something else, those items will still have to be covered under what's allowed with the CARES Act funds.
Okay. Thank you.
Mr. Chair.
Mr. Glover, yes.
Yes. I think Mr. Cooper's in this meeting, correct?
Correct.
All right. So, Mr. Cooper, I want to ask a quick question to hopefully clarify this to where we can do the vote. In the event money came in, it was used improperly, it would have to be given back. Is that a yes or no?
Well, I'm not sure we're talking about improper use of funds. I think.
Well, if it was double, all right, bad choice of words. If money was spent incorrectly and it was doubled up, etc., it would have to be returned. Or in other words, you can't spend it twice. You can't spend the same dollar twice.
Right. I think it would. The report would come back to council, and then it would be up to council working with finance how to reallocate those funds if it turned out that part of the subsidy that was provided by the council was not needed.
Okay, and so therefore, with the amount of time that he's asking for, I believe, and maybe the sponsor wants to ask this, to defer it until November, there'd be enough time in the event language is incorrect. We would be able to correct it, or the sponsor would be able to correct it, bring it back to us, and we would be able to go forward with it, if I understand the deferment on this correctly.
If it was deferred till November, I'm sorry, I'm trying to follow two meetings at the same time, so I missed the deferral motion. But if that is what is pending currently.
Then, Chair, may I ask the sponsor, is that your intention, sir?
Right now, we have a motion on the floor for approval. We haven't had a motion for deferral.
Okay, then my apologies. I thought I heard deferral. All right.
Councilmember Hall.
So for additional clarity, Chair, because there's such a large time frame between this legislation doesn't have to be deferred even anyway from the floor because it won't come back until the reports are completed. So we've got 2 months before this ever comes back, and that will come back with the external audit, with the recommendations, and once over from finance department and the administration. So we've got multiple sets of eyes on this that will review it once it comes back. And then when it comes back, if there's any redundancy, then it would come to council and we discuss it before moving forward. If there wasn't any found, it would come back to council, and that would be something that I'd just eventually end up withdrawing because clearly there would be no redundancy there to even debate.
All right. So, Mr. Chair, if I may, can I get clarification? Are you asking for a deferral or are you not, sir?
No, I want to get it approved as substitute.
You want to get it approved tonight? Okay. I misunderstood. Okay. My apologies, Chair. My apologies.
Thank you, Mr. Glover. So we are right now on RS 2024-96 as substituted. There's been a motion to approve. It's been properly second. And we're in discussion, and we've had good discussion. Is there any other discussion that we have? Councilmember Hall, I have a question. Would you be willing to entertain a deferral on the approval prior until November or when the study comes back?
No, Chair, I wouldn't. And matter of fact, of course, again, that was something I intended to do from the floor once we moved it as substituted, and then have it re-referred back to this committee and the Budget and Finance also.
And Mr. Chair, I think that's where I got confused. So that's why I apologize.
Right. We remember we discussed that, and it was passed in Budget and Finance also. So that's why passing it here in committee, once I could get the substitute on tonight, then I would entertain the conversation about deferring and having it re-referred to both of those committees and brought back and, deferred until I believe the second meeting in November. We just have to see how the holiday falls. But since they won't have the report to the end of October, the beginning of November, we want to give them at least, a few weeks to go through that information. And that's why you saw the December date in there. So we've got plenty of time. Again, I'm not opposed to that at all. I just want to make sure we get the substitute on and get it passed as substituted, and then we can go from there.
So Councilmember Hall, currently we do have the substitute on the bill. So I think that's where Councilmember Glover, if I'm not mistaken, is that where the confusion is, that we have the substitute on the bill?
Now, the only confusion was I was asking, were we asking for a deferral in committee or not? The sponsor clarified it. I said we move it. It's time for a vote.
Good deal. Any more discussion? Been moved and properly second, RS 2024-96 as substituted. All in favor, please raise your hand on the WebEx.
I'm an aye, Chair.
Thank you, Councilman Glover. So, yes votes right now: Emily Benedict, Councilmember Emily Benedict, Councilmember Welsh, Councilmember Hauser, Councilmember Hall, and Councilmember Glover. All opposed? Everyone, please drop your hands. All opposed, please raise your hands on the WebEx screen. Thank you. I have Councilman Porterfield, Councilmember Hurt. So motion passes 6-2. Okay, moving on. Resolution RS 2020-503 from Toombs, Taylor, and others accepts a grant from the United Way of Middle Tennessee to the Metro Action Commission to support delivery of supplemental nutrition assistance program, employment, and training related services. Do I have a motion?
So moved.
Have a second? It's been moved and properly seconded. All in favor?
Aye.
Aye.
We can do a voice vote. Aye.
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 All opposed? Any abstentions? Motion passes. Resolution RS 2020-507 by Taylor and Welsh approves a resident clinical fellow education agreement between the Metro Board of Health and Vanderbilt University Medical Center, VUMC, residents and clinical fellows to experience training in the Metro Public Health Department's tuberculosis elimination program. Do I have a motion?
Motion, Swoop. Second.
Second. It's been moved and properly seconded. All in favor with a voice vote, say aye.
Aye.
Aye. Aye.
Any against? Abstention? Oh,
Mr. Chair, you might just want to get a little discussion just so that someone can explain what the resolution is about.
thank you.
Okay.
I'm watching the clock. I do apologize. I'm sorry. Is there anyone on the call that would like to explain?
Mr. Chairman, this is Tom Sharp from the Health Department. That's a long-standing relationship. Vanderbilt sends us a doctor over. We get some work out of them. They learn how to do what we do in the TB program.
Good deal. Thank you, Mr. Sharp. So, any against? And any abstentions? Great. Moves 8-0, no abstentions. Resolution RS 2020-508 by Toombs, Taylor, and others accepts a grant from the Tennessee Department of Health, the Metro Board of Health, to prepare for, respond to, and recover from the public health threats, including but not limited to response and recovery from COVID-19. Do we have a motion?
So moved.
Second.
Perfect. We have a motion and a second. Is there any discussion? Mr. Sharp?
Mr. Chairman, that is I want to say $86,000. It was conveyed to us by the state for supplies specifically.
Thank you, Mr. Sharp. Any other discussion? Seeing none, all in favor with voice vote, say aye.
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 Any opposed? Any abstentions? Measure passes 8 in favor, 0 against, no abstentions. RS 2020-509 by Toombs, Taylor, and others accepts a grant from the Tennessee Department of Health to the Metro Board of Health to provide an array of programs and direct patient care services to meet the public health needs of Tennessee's citizens. Do I have a motion?
Move. Second.
Mr. Sharp, what is the array of programs that we?
Thank you, Mr. Chairman. That is a long-standing grant. It's called a grant and aid. It is the only pot of money that I'm aware of that comes to the department that doesn't have strings all over it. It is for basically whatever you need to do with it. It's the most flexible bit of money that we have, and we use it for all kinds of different things. it can help us when we have someone working out of class for a while. We can use to pay that. We try not to put staff on it because it's been a fixed amount for at least the 10 years I've been here. It's been the same amount of $725,000. But it really is a very helpful bit of money for us.
Thank you. All right. All in favor, please vote with a voice vote of aye.
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 Any against? Any abstentions? Great. Measure passes 8 in favor, 0 against, 0 abstentions. Moving on to bills on second reading. BL 2020-421 by Mendez, Pulley, and others. Amends Title 10, Title 13, Title 15, and Title 16 to permit the Nashville Fire Department, fire marshals, Metro Public Works, Metro Water Services, and Metro Codes to enforce emergency health orders.
Move to approve.
There's a letter on file by Councilmember Mendez. We have a motion to approve in a second. Is there any discussion?
Mr. Chairman,
Welsh.
I'm sorry, I just didn't hear the caption. Everything froze, so I'm not sure what bill it is that we're talking about because you disappeared.
We are discussing BL 2020-421, and that amends the Title 10, Title 13, Title 15, and Title 16 to permit the Nashville Fire Department, Fire Marshal's Office, Metro Public Works, Metro Water Services, and Metro Codes to enforce emergency health orders. And there is a letter to approve from the sponsor. Seeing no discussion, I would like to ask for a vote by voice. All in favor?
Aye.
Aye.
Any against?
Aye.
Is that a vote against? Any abstentions? All right, measure passes 8 in favor, 0 against. All right, and it's our last item of the evening, BL 2020-422 by Mendez, Pulley, and others, amends Metro Code to permit the mayor to enlist Metro employees outside of the Health Department and MNPD, Metro Nashville Police Department, to issue citations to enforce emergency health orders.
So move.
Second.
It's been moved and seconded. Do we have any discussion? There's a letter for approval from the sponsor.
I can just say that Councilman Pulley's intent on this is to, do you want me to say?
Yeah, please do.
Okay, Councilman Pulley's intent on this is, in the case that there's an issue with COVID-19 and people not wearing masks, other departments have permits that they can withhold until people come in compliance with the things that have been mandated by the government, and it can stop work in order to do this. So this was just another way of making sure that we have compliance and other mandates that have been offered by the mayor's office and the medical director.
Thank you, Councilmember Hurt. All in favor, please vote with a voice vote of aye.
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 Any against? Great. Any abstentions? So that is 8 in favor, 0 against, and 0 abstentions. And that concludes our calendar. Thank you so much. Thank you all. Thank you, Councilmember Hurt, for helping to fill in as the immediate past chair of health. Also, I want to announce that Councilmember Welsh has agreed to be the vice chair. And so thank you, Councilmember Welsh. I will be communicating with you all moving forward. I know there's been conversation in regards to possibly moving some of the meetings, so we're not bumping up as close as we are right now to the council meeting. So we can be in discussion in regards to that. Any thoughts? If you have any thoughts, please send them my way. And thank you so much. Motion to adjourn.
Aye. Second.
All right. Second. All right. Aye. All in favor, please say aye.
Aye. Thank you, Chair.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.go.